May is Skin Cancer Awareness Month, and it's time to talk about the importance of annual skin checks. Dr. Eric Stanek, Chief Medical Officer of DoctorsNow, is here for today's Hello Health, and an important time to talk about this. It's Skin Cancer Awareness Month.
Yeah, happy to be back towards the tail end of Skin Cancer Awareness Month to talk about the importance of skin health and different treatment options for skin cancer.
Well, because it's the tail end of the month, but really just the beginning of a time when we're spending a lot of time outdoors.
Yeah.
Talk to us about your services, because you all have a great system, or a system for a non-surgical form of skin cancer removal.
Yeah, that's right. We've partnered with a company called Gentle Cure to offer a non-surgical alternative for certain types of skin cancer. And this is done through radiation. It's, the name for it is IG-SRT, or Image-Guided Superficial Radiation Therapy. And it's FDA approved for non-melanoma versions of skin cancer. So basal cell carcinoma, squamous cell carcinoma, and different subtypes of that. A lot of these are amenable to treatment without having to undergo surgery. Surgery is still an excellent option for a lot of these patients, but for patients who are poor surgical candidates due to complicated medical history, or for patients who just don't want to undergo surgery, it's an excellent option for that, and we're happy to offer that.
And a good time to remind people too to get skin checks. So should we be doing that every year?
Yeah, in general, people should be getting in for their annual skin checks, especially if you have risk factors for skin cancer. Skin checks are more than just screening for skin cancer. It's, if people have suspicious moles or lesions that have recently popped up or have changed in size or appearance, then you would want to get those checked out. Some people just care about the health of their skin, and there's some lesions that they don't like the appearance of. We're happy to give you options to remove those. But in general, skin cancer screening is done through annual skin checks. So if, when people think about how cancer screening is done, it's always about early detection. So for colon cancer screening, you get in for your colonoscopy. For breast cancer screening, you get in for your mammogram. For skin cancer screening, it is a skin check with a certified provider.
So one more thing we should be adding to our list to do every year.
Yeah, absolutely.
So in addition to these medical dermatology services, you also offer cosmetic dermatology at some of your offices?
Yeah, we've recently launched cosmetic dermatology at our Altoona location. Some products that people may be familiar with are Botox and Juvederm, things like that. A lot of what we do at DoctorsNow does center around the idea of healthy aging, and the appearance and health of your skin is an important part of aging well.
What else can we do to really be protecting our skin and aging it well, aging it healthily? Healthfully, what's the word?
Yeah, healthily.
Yeah, something like that.
I think is the word. I think the thing I want to mention first is that in the broader scope of this conversation, when it comes to skin health, a lot of it centers around sun exposure and sun protection. But we by no means want to tell anybody that they should spend their whole life indoors or under fluorescent lighting. One of the most important things you can do for your overall health and well-being is to be active outdoors with friends and family. And we encourage everybody to enjoy everything that Des Moines has to offer this summer. Now, that being said, there's things you can do, especially if you're going to be spending extended time in the sun this summer. Using sun protection like an SPF 30 or higher, and applying that frequently when you're outside. Taking breaks to find shade or to go inside every hour or so. Just doing those things intermittently goes a long way to protecting the health of your skin long term.
Yeah, because we don't, especially when we're young, we don't always think about that. I know that growing up in the 80s, we especially didn't, but it's really important to, as you say, take those sun protection measures.
Yeah, absolutely. And like a lot of things in health, the development of skin cancer is something that takes decades in most cases to happen, and it's exposure over time of how much sun your skin is exposed to. Of course, people who have had previous skin cancer, have family history, or have spent a lot of time in the sun without using protection like SPF 30 or protective clothing are at higher risk for skin cancer, and those are people that would want to come in and get checked.
Well, thank you so much for being here. Great reminders and advice for Skin Cancer Awareness Month and all the options we have. We appreciate it.
Yeah, thank you for having me.
And you can learn more. Just go to DoctorsNow.com or call 515-471-1860. You'll find locations in Altoona and West Des Moines, and you can see more on social media.